and doing well. As you are aware, the second wave of COVID pandemic has shaken up everyone. Some of our team members and even family members are affected from COVID. It's really a tough time we are all passing through. So Microlab's Cardiac team has taken initiative to enrich your knowledge, understanding, and to manage the present situation through this program. To help us in this endeavor, we have with us a renowned speaker, Professor Dr. Sharma VSN Rachakunda, going to guide us on how to manage and monitor COVID at home. So let me take you through the brief introduction of Professor Sharma. Yeah, Dr. Professor Sharma VSN Rachakunda is a consultant physician, Manipal Hospitals, Bangalore, and adjunct faculty, JSS Medical University, Mysore, and is also online professor for MRCP program, Texila, so American University, and a fellow of the IMA Academy of Medical Specialties. Dr. Former Secretary, American College of Physicians India chapter, and has experience as a senior medical scientist in TB Research Center, ICMR, Chennai. So Dr. also Emeritus Professor, Rajiv Gandhi Institute of Medical Sciences, Srikakulam, Andhra Pradesh, and received Best Doctor Award from Delhi Medical Association in the New Delhi in the year 2007. So Doctor has presented over 30 research papers in various international national conferences, and Dr. Sharma has have own CME club. It's called Dr. Sharma CME Club, comprising over 250 doctors conducting regular monthly CME program, and also a doctor has given more than 280 CME talks he has presented. So without holding you further, so let me request Dr. Sharma to take the proceedings further. Sir, please.
Thank you for a very nice introduction and a warm welcome to me. I'm too pleased to be with all of you to share what is the current state of knowledge on home management of COVID. Our emphasis is mainly on how best we can diagnose the condition very early at home, and having identified that it is COVID, how we go about. This slide has been covered already by my friend Prasad about what I am doing and what are the responsibilities I am holding. More than anything, this tells us that we are more responsible in a situation where we require to work hard to see that we help each other and help ourselves. Okay. Now this list is given here. A COVID playlist is given. On there are around 12 videos on that. I request you to have it some time to look at those things. Now, what is the emphasis today? So we are going to look at the home treatment and monitoring. From whose perspective? Not from a medical expert, but from a person who is a common person in the public. And most of us today, we hear a lot of fatal news. Many untoward things have happened. A lot of people are suffering. All that will certainly have a strong amount of fear in us. And let us try to annul that fear and guide all of us into action. And this is up to date till 22nd May. As I always say, nothing is ours. Idam namama means in Sanskrit, nothing is ours. We are utilizing the current knowledge to educate ourselves. Each presentation is an education, and it is a submission to the Almighty and the Gurus. With that, we will start. And the presentation will be available on the website. And those of you who wanted to contact me, you can do that on my WhatsApp number as well as mobile number. That number is here, 93805 21221. So that it becomes easier for you to interact. Okay. Now, look at this. There is a curve which describes the course of illness of COVID. Starting from the 0 day means the day of first symptom. The virus excretion can be seen, the relative frequency of days of onset of symptoms of onset, and the relative frequencies are plotted here. By 7th day, usually the symptoms subside. By 14th day, most of the symptoms subside. Similar is the virus excretion also. By 7th day, half of the viral excretion is brought down, and by 14th day, usually the viral excretion is absent. That is why the reason that we try to keep in isolation for 14 days. You need to understand two terms quarantine, and then isolation. Okay. Quarantine is if somebody is just exposed to COVID and the risk of COVID is there and the suspicion is there but there are no symptoms, no test is negative but still they are kept for 10 days. Quarantine period now earlier was 14 days, it has been reduced to 10 days. Okay, that is the update. Quarantine means somebody who does not have symptoms, somebody who is not tested positive, but required to be kept away for the sake of observing whether he will develop symptoms and disease. That is called quarantine. Don't get confused with the word isolation. Isolation is a more intense one, separating the person who is positive for symptoms or positive for the test that we do, and then he is already a case of COVID, we separate that person into a separate room or a facility by the government or private, and that is called isolation. How long is that required? 14 days. How long is quarantine required? 10 days. Okay? So quarantine is for non-infected, suspected contact. Isolation is for those who have disease symptoms or evidence of infection, who should be kept separate because they are bound to transmit the disease to others. That's why it is more rigorous. Another important thing is the virus starts excreting right from 4 or 5 days before also. So this period is called the asymptomatic period. So just before the symptoms start, the viral excretion starts around 4 to 5 days before the actual symptoms occur. And this is called the pre-symptomatic phase. This is the pre-symptomatic phase or asymptomatic care. Some people, they get exposure, they never develop the symptoms. They remain asymptomatic throughout after 7 days also. They are the asymptomatic people. Now, how many types of cases? We had no symptoms, no contact, very healthy, like all of you are in the meeting. Now, the second one is asymptomatic. COVID test is positive, but symptoms have not developed. This is a dangerous person because he doesn't have symptoms, he doesn't seek any medical aid, but he can jolly well transmit the virus to others. So such person should be monitored and isolated separately. The next one is we have pre-symptomatic. I told you this part, they're going to develop the disease in the next 2 or 3 days or 4 days. So are people who had symptoms and they're waiting for the report that is called the pre-symptomatic illness. Then comes the ILI. What is ILI? Influenza-like illness. What is that? Influenza-like illness. Like any other common viral upper respiratory infection, influenza-like illness is a very mild illness. I promise you that 90% of COVID is like this. 90% of the people who they get tested positive, they will end up with only mild illness. Only 10% of them will go into higher degrees of illness, which is called COVID pneumonia. You can say the first one is the nose COVID or throat COVID. The next one you can call it as lung COVID or COVID pneumonia. What happens if you get lung COVID? Then the chances of getting oxygen levels falling and complications and more difficult to recover, and very rarely fatalities also can occur. So we need to identify those people who are moving from mild illness to moderate illness, also called pneumonia. This is called moderate illness. So what is our responsibility? To identify mild illness and start the treatment immediately, whatever I tell you now, and keep them separate, isolate, and then watch them whether they are the mild illness and coming out, or a 10% chance they may go into pneumonia or infection of the lung part of the body, which is called the moderate illness or COVID pneumonia. Unfortunately, only a few percent, let us say 2% of this 10%, another 2%, that is, roughly 100 out of 2, will end up in severe complications. COVID is a disease which can be fatal. But this doesn't mean that everybody is going to get COVID or going to die. So my responsibility and your responsibility is to see that we identify in the very early stage and do not allow the disease to be transmitted to our family members and to our contacts who come in contact with us. That way we can limit the burden of the society, limit the burden on the healthcare, limit the burden on ourselves. The second responsibility is to see that the mild illness is taken care of and monitored properly, and early recognition of moderate illness and ask for help. Now I'm going to tell you what is mild illness, what do you do at home, how do you recognize moderate illness, what can you do still at home for the moderate illness also in the early part, and when do you run for help to a hospital. I am not going to tell you about COVID complications, severe illness, because the purpose of the talk is not to give frightening information about those small proportion of people, but to educate all of us to be able to or to empower ourselves to take care of the mild illness. Okay. And finally, those who are on ventilator, they have all sorts of complications. They have the cytokines, the chemicals in the body going everywhere. There is clots happening in the whole body and the respiratory failure, and they end up with a fatality. That is quite unfortunate, but for the person who gets it, it is 100%, I know. But then we can help ourselves to see that we do not progress from ILI to severe illness and dangerously ill disease. All the fatalities, most of them are occurring because initially the disease is missed and there is a delay in diagnosis, there is delay in starting treatment, there is delay in identifying the change in the disease from the mild to the moderate, and the delay in putting the patient under proper hospitalization and treatment. And that is ending in severe illness and dangerously ill. So you understand this is very important slide for you to know our responsibility to contain the disease and see that we don't get affected. So then you must know what are the symptoms. By now all of you are very familiar, lots of WhatsApp and lots of forwards, this, that, I urge you, don't search for COVID information. One, what you should not do, don't search for COVID information on the net. Don't watch COVID forward videos. Don't heed to unfiltered, unscientific informations that you get on the WhatsApp or any media, and don't read any frightening or fatal messages or negative news. Because you are untrained persons in medicine. You do not know what is correct and what is wrong, and your mind is clogged with all those things. And you get into what is called COVID psychosis, a disease called COVID psychosis, which is very dangerous than the disease itself. Okay? Now, all the same, I must know what are the basic symptoms of this disease. It is usually cough, a dry cough. Not very productive to start with, a dry cough followed by or associated with fever, and there could be nose cold also, nose block, sore throat, pain in the throat, and the more specific one is loss of smell and taste. What is that? You will not be able to smell the objects which were smelling easily earlier, not recognize, and taste also, jaggery like taste or tastelessness are reported. These two symptoms together are as powerful as an RT-PCR test. What does that mean? It means that somebody presented with cough, cold, fever has loss of smell. It's almost confirmatory of the disease. Why the smell is affected is a different question, which I am not going to take up now, because there is a biological reason for that. And some people have weakness along with the disease and after the disease, and some people have loose stools or diarrhea also. Okay. Now, what are the serious symptoms of the disease? breathlessness, extreme weakness, fatigue, exhaustion, and altered sensorium. What is altered sensorium? If you ask the person to count, 1 to 20 in reverse order, he may not be able to do. Give him simple maths, he will not be able to do. Ask him what did he take in the breakfast yesterday, he may forget. And he may not be identifying things and time and place, people as normally is done. These are simple tests for altered sensory. Breathlessness, the easiest test is asking him to read a small paragraph from a book, around 4 or 5 lines. He will have difficulty in reading that. He will say, yeah, fatigue, muscle, body aches, fever. Huh? I'm finding it difficult. Like that will be the breathless, severe breathless. Extreme exhaustion, not able to sit through or stand, feel like always lying down. These are severe symptoms. Okay, you can see headache is a very common symptom of COVID. Okay, and then congestion and runny nose, loss of smell and taste underline, and then cough and sore throat, shortness of breath, difficulty in breathing is a dangerous symptom, not good. And then fatigue, muscle and body aches and fever and chills and rigor, and then nausea and vomiting. Majority of us, we are preoccupied with the fever. Sir, yesterday it was 100, today it is 101, day before, today evening it is 100.5. So the fever is a reaction of the body for the virus. It is warning you that something is going wrong. It is not that fever is dangerous, but keep monitoring it. I'll tell you when fever could be a dangerous sign. Okay, just don't be carried away by the fluctuations in the temperature and your cough intensity. These are part of the disease. They will come down in a matter of a week or 10 days at the most. The symptoms appear 2 to 14 days after the exposure, as late as 14 days. Usually 2 to 3 days after the contact. You remember, yeah, I went to that mall, I went to this bank. Then probably from then 3 days now. Another thing that is happening is people are going for vaccination, either first dose or second dose. After the 2 or 3 days, develop, no, I had vaccine, I had. No. It is not the vaccine which caused the COVID, but it is the crowd that you met there without proper masking. You went and you have caught it from there. So that is the reason COVID illness can never be present after the vaccination. From the vaccine, you don't get it. That you have to erase from the mind. COVID test will not be positive after vaccination. But the fact that many people are developing after vaccination is because they are unprotected. They went without proper guard and exposed themselves to the crowds in the center. Some of them are already COVID patients. They have given it to them. They brought it home and suffer 2 to 3 days. So ignore all the messages related to that. Now, what are the 3 types of cases we have? A person has a contact. Yes, he went to a mall, he went to a hospital, or he visited a friend who reported later that they had COVID, and he has symptoms, and he is tested positive. What test? Either a RT-PCR nose swab, or a rapid antigen test, or a CT scan. Either one of them is good enough. One is sufficient. You don't require 4 or 5. So, COVID contact, COVID symptoms, test positive. What is he? He is now a definite case of COVID. What do? Isolate and treat. Isolate in a separate room, and then he has to mask himself. All others also should mask themselves up, and the distance should be maintained. Everything, utensils, everything should be separate. I'll show you in a separate slide and start the treatment. What treatment? We will show you later. Then, the kind of second thing is, he has the same amount of contact like the previous person, and he has cough, cold, smell loss and other things. But his test is either negative or not yet tested. In both the cases, such person, he or she, is a probable case. Means there is a high probability that this patient also is having COVID. Then what do? You put them separately from others, test them as soon as possible, and of course treat them in the same way as you treat a definite case. The treatment for a definite case is same as the treatment for a probable case. The difference is that the testing has happened in the definite case which is positive. Here he requires to be tested. Once he becomes positive, he becomes a definite case. Then the suspect case. Who is this? He had a same family, another person, he also had a contact with the COVID positive person, but not yet developed any symptoms. Test is done negative or not done, then they have to be quarantined for 10 days and earliest tested. They should not go into the community. They must quarantine themselves. What is quarantine? 10 days of separate stay at home without contacting anyone. What is isolation? 14 days of very intense separate stay in your home or in a center. So now you understand, a definite case is one which is COVID contact positive, symptoms positive, RT-PCR or rapid antigen test or CT is positive, and isolate and treat. Probable case, contact is, history is there, symptoms are there, test not done or waiting for the report or done and negative. Such people have to be quarantined, and if not done, test to be done and treat them like a definite case. The other day, in our very close family members, the mother is a definite case. And the daughter had tested negative, but she had some symptoms of the COVID. So he put her in a separate room for 14 days and brought her out, and she recovered, both mother and daughter. Okay, suspect case means a person who is COVID contact and then no symptoms and no test is done or negative. Such persons, no treatment, only quarantine and test. In the same family, 4 others were there who were suspect cases, who were test negative, who did not develop symptoms. We just quarantined them. All of them have come out. Okay, now you understand what is the definite case, what is the probable case, what is the suspect case. The mode of action is different for different categories of cases. Now, what is rapid antigen test? Rapid antigen test is like a card, it will be there. And one line is negative, if you get 2 lines, it is positive. This is a very good test. Government of India, ICMR approved. And today we have Coviself, an app also is there, MyLabs. You can buy that, this one, and there is an instruction how to do the test. That is also approved. That is as good as any other rapid antigen test. Empowering the people. So this is to empower the people, and no prescription is required, and ICMR approved, Minister of Health and Family Health approved. Now I do a rapid test. I know in minutes whether it is positive or negative. If it is positive, no more RT-PCR. That is good enough to call that person as a case, and don't do RT-PCR. Straight away start quarantine, in isolation and treatment like a definite case in the previous category. Supposing the person has tested negative on the rat test, then does he have symptoms? Is he a probable case? Then send an RT-PCR. Suppose the person is asymptomatic. For that moment he is negative, but keep monitoring him and put him under quarantine. You understand? This is how we have to go about. RT-PCR sometimes takes time, and there may be crowds, you may not get the test done. You are now empowered by the rat test. And rat tests are made available almost everywhere. You can get a rat test done. Positive, no more testing, confirmed as COVID, isolation, treatment. Negative, symptoms present of COVID, it is a probable case, do RT-PCR and also start treatment. And negative for the test or rat test, symptoms are not there, asymptomatic, declare negative for the moment, follow for the symptoms and put him under quarantine. As simple as this. Okay, let's go. Now, somebody tested positive. What should I do? Should I immediately rush to the hospital? No. Government of India has clearly decided that they are not going to admit mild cases because the number of cases is so huge, no hospital can accommodate. They are only for people who deserve oxygen and other things. Only when they turn this one moderate, they require admission. So what do? Either eligibility for home isolation, you check. If they are home isolation, then there is a mild illness, they put them under home isolation. Supposing very poor people, they don't have isolation facility, they have only one room, And then government has facilities that are, these are called the COVID care centers. You can isolate them in the CCC. So somebody is tested positive. What is the behavior for us? No panic. First of all, isolate the person. Where? At home, preferably at home. If there are facilities, that the doctor who is whom you consult, along with the family, they decide whether they will be able to monitor the patient at home. They must have minimum gadgets to monitor. And if that is not possible, they admit to COVID care center where monitoring can be done. This is for mild ILI illness or asymptomatic individuals who are tested positive. Supposing somebody is turning moderate by monitoring, then you will not be able to manage them at home because the requirement for oxygen and IV medication will be there. They require to go to the dedicated COVID care hospital, DCHC, or any private institution which is admitting COVID cases. Okay, who will decide somebody is in the home or in the isolation at they admit or who is in the hospital? It is the doctor and the healthcare worker. Preference always for home isolation. There should not be other serious diseases and there should not be very old people. Oxygen saturation should be good. There should not be any breathlessness and monitoring for the worsening of the disease. So now you understand this is called the triage. How do I triage a patient once tested positive? I showed you in the previous slide how to go about testing. In this slide I showed you the triage. Triage means channeling them either to home or to COVID care center or to a hospital. These are the things that you may require to have at home. A pulse oximeter, a digital thermometer, BP apparatus and sugar monitor. Those of you who can afford, you can also have a sort of the oxygen concentrator which is on the right hand side of the picture. It is a little expensive gadget, doesn't matter. This is the pulse oximeter. Okay, pulse oximeter, you switch on the pulse oximeter and then put your middle finger into that. Keep it near the chest like that. It will start showing the result. In a minute, it gets stabilized. And the display will come. And that display you have to identify as this one. It is showing now 98 and 84. Okay, that first the bigger digit is the oxygen saturation. The smaller size letters are the pulse rate. Both you have to record. Likewise, if you have a home BP monitor, you can use BP monitor. Temperature with that gun you can record, or a digital thermometer you can record, or sugar also you have to check. Diabetics 3 times a day, they have to check when they have COVID. Why? Because COVID itself increases the sugar levels in a diabetic. And some of the treatments that we give also increase the sugar levels. So there's nothing to be panicky about. Earlier my sugar was only 100, now it is 220. It will be like that. But you have to identify and control the sugar by medication. These are the basic things. Okay? So I showed you how to do the pulse oximeter. And then what do? If a family member in a household is a presumptive or a confirmed. I told you what is a presumptive, what is a confirmed case. Home isolation. In a separate room, start home care guidelines and treatment, wear N95 mask, use disposable. The patient should wear N95, preferably the family members also. Now, we know the COVID is so severe, the regular medical mask may not be adequate. Cloth mask may not serve unless you use a double mask. If you have an N95 mask, it is better. Today there is a publication saying that all the people in the house where there is a COVID case, the recommendation is wear N95. Till yesterday we were telling either you wear N95 or cloth mask 2 layers or wear medical mask. But it appears that we will be asking for N95 mask for all the people in the house wherever there is a confirmed case. For what? This is to cut the transmission. N95 is very powerful to filter 95% of the virus when properly worked. That is good enough. 5% load is not going to do anything. So first of all, home care isolation, start the home care guidelines, use N95 for the patient and the family, monitor the symptoms 3 times a day, minimum. I even advise 6 hourly to be precise. Watch for fever, breathlessness, and oxygen saturation as measured by this pulse oximeter. All of you have a pulse oximeter at home. Okay. And those of you who have pulse oximeter at home, if somebody is suffering, you can loan it for the time being. It is not going to become soiled. You can clean it with alcohol swab and reuse it. So please share the pulse oximeters in case somebody, your neighbor or somebody needs it. And most important, trace if the patient had any contact with the COVID patient. Because you have to inform all the persons whom you came in contact, they might also be positive and they require probably identification and treatment. This is to cut the transmission. Inform all your contacts and ask them to get tested. Let us say in the last 4-5 days you have visited or some people have come. Tell all of them without any embarrassment, I am COVID positive. So please you also get tested. Like that. Okay? These are the home care general guidelines. Isolation in a separate room, following the guidelines and treatment, wearing N95 mask, caregiver, identify only one caregiver, not everybody is helping the patient. One person who is good enough to manage with the patient is the caregiver, uses an N95 mask or a medical mask which has got 3 layers or a double cloth mask, preferably N95. And patient should monitor symptoms 3 times daily. What is the monitoring? I will show you. Watch for fever, breathlessness, and SpO2, and trace where he got the COVID so that you can see whether who are the contacts of that person and inform all the contacts. This is a minimum expected civic behavior of all of us. If we don't do that, we are failing in our civic responsibility. You understand, as a family man or a woman, you have a responsibility towards yourself and family. As a citizen of this great country, you own a civic responsibility. Don't shun the civic responsibility. This is the only way we can reduce the burden on the healthcare and reduce the fatalities. Now, all contacts and family members of a test positive must be in quarantine and take a COVID test to see whether they too are patients or they are still negative. Now, what are the 4 important things? I am again bringing out isolation, N95, general measures, medicines, and testing all the contacts. Okay? This is the most important first step if somebody is tested positive. I am having positive, sir. I am sleeping with my baby, husband and brother, sister. No good. Because you will transmit the disease. Particularly there will be old parents and you are not supposed to mix with anyone. Okay. Now, what to do for general measures? I told you all general, in this slide I said general measures. What are the general measures? Here they are. Medication as per guideline. Plain water steam inhalation. Here I have a inhaler like this for you. I'll show you. This has got a, this can be powered to a jack, and it has got a thermostat with a heater there, and you have the cup wherein you put the water there, fill it up with clean water, not the overhead tank water, which contains all sorts of bacteria, fungi and all, and this is one cause of mucormycosis. People are inhaling bad water and all the bacteria, other fungi are going inside. Very clean filtered water or RO water you use in this and cap it like this and put it for the plug it up, and then use this this one, to put the like that. How much time? 10 clear minutes. Put a stopwatch and do 3 times steam inhalation for 10 minutes. So use a steamer. This is called vaporizer or steamer. Very economical, around 300, 400 rupees. You can get a very good one. Okay. So you buy that. If you don't have, otherwise if you have, it is fine. The second thing is throat gargling with salt water. The one reason of mucormycosis is not using salt water. Because the fungi, the spores will not thrive in salt water. The moment you gargle the throat with salt water, 80%, 90% of the problem is solved. Plenty of oral fluids because COVID requires a lot of fluids in the body. If you don't drink enough water, always keep a 1.5 liter, 2 liter bottle next to the patient, and this is of course clean water, and ask him to drink water as frequently as possible. All of us should have a habit of taking at least two mouthfuls of water every 1 2 hours. Okay? Stay at home only. This is a dictum. This is the Lakshmana Rekha. If you cross the Lakshmana Rekha, you are undoing the whole thing in the community. Do not contact anyone. No visitor, no visiting. No visitor, no visiting. Spouse, parents, grandparents, children, all must be tested. We have a 1.5 months baby who tested positive 5 days back. So anybody can get it. Watch for all COVID symptoms. You already know what are COVID symptoms. I have shown you what is your behavior, how to go for testing, how to trace the patient, what are the guidelines if somebody tested positive, what are the general measures that you are applying here. Now, breathing exercises. What is breathing exercises? I'll demonstrate here. Just watch me. What you do is sit straight like this, like a Raja or a Rani, not like this, like crouching, and then take deep breath. Or either way, breathe through the nose, fill your lungs. Normally, 50% of the lungs are not filled by us, by our breathing. If you take deep breath, lungs will have the capacity to expand and they get used to be useful. The lower parts get aerated, and then very important. How much time I do? At least 5 to 10 minutes, 3 times a day. Each minute, 5, 6 breaths. Like that 5 minutes, 25, 30 breaths, like that afternoon and night. Again, I am demonstrating. You can think of Omkara, you can think of any God or Almighty you like. Better mind also while doing this. There's nothing wrong in that. More important is inhalation, breath holding, exhalation. What is the difficulty in doing this? I just cannot understand. N number of times we tell, none of us do this. And we end up in Asar, oxygen is falling, oxygen is falling. We can't hold oxygen. You have to start doing this. Then only your oxygen you can hold. You have the capacity to do that. Then use a respirator. What is this? This has got 3 balls. They move up and down like that. Now, what you have to do is there is a tube here and then like that you keep sucking. Okay? Then these balls will move up. And this breathing exercise, this is what is called the Respirometer. It's available for a simple price of around 500 or 400. Order one and do these exercises every day, 5 minutes in the morning, 5 minutes in the evening and everything. And you also have, the balloons. So you have balloon, buy some balloons and start blowing the balloons. Okay? Regularly. And morning, afternoon, night, you play with the balloon like a child. This is the time to play with balloons again. Okay? So I have kept a balloon also for you so that I can show you how to. All of you know how to. Like that, you keep blowing as much as you want, and you do that for 5 minutes in the morning and evening. So the respirator, the breathing exercises, the balloon, and room walking. At least 2,000 steps or 3,000 steps. In your mobile, there will be step counter. In a day, you have to do. And in bits of around 500 steps each time. Make it 6 into 500, 3,000 steps. Though you are a patient, you have to walk. And then prone position. Try to sleep at least 1 hour in the prone position, like this. I'll show you the picture. Not we always sleep like this. We should not. Either on left side or on the right side or in the prone, at least for 25% of the time of sleeping. And 6-minute walk test. What is that? So I do the oximetry and then with this and then put it on and put it on my finger and note the reading. Keep the hand in the chest level and note the reading. Oximetry at rest. And then walk for 6 minutes simply in the room, not running or anything. Okay. 6 minutes, that is 98 and 94 because I'm speaking. Doesn't matter. Okay. Now again read the oximetry after 6 minutes of plain simple walking. What should happen? It should be stable or the oxygen concentration will go 1% up. Supposing it is going down by more than 3%, so somebody has got 94, 96 to start with and gone to 93, it's an indication that he will go in for desaturation. It's an early warning for probable difficulty into a moderate case. So you just understand 6-minute walk test. So general guidelines, I told you, specific guidelines like, the plain water steam inhalation, throat gargling with salt water, plenty of oral fluids up to 2.5, completely at home, not contacting anyone, no visitor, no visiting, spouse, parents, every person who is drawing food from the same house, including the servants, if you have live-in servants, they must be tested. Watch for all COVID symptoms. Don't have any servant coming from outside. First people who are going to give you disease are your servants, your helpers, your plumbers, your electricians, your drivers. Just for a month, your self-help is the best help. The spouse should be helped by the male member and male member should be helped by the female. All of us should share the work and see that we don't get the disease from outside. Then breathing exercises, as I told you, balloon blowing, respirator use, room walking, prone position, 6-minute walk are the tools for you to improve your lung function. If you improve your lung function, you don't require oxygen. In fact, you don't require a doctor. I tell you, you will make all of us jobless if you are doing this even in the non-COVID times. Okay? Start practicing. This is a good practice. Like, we eat 3 times food. Why not make 3 times breathing as a part of our routine? You understand? Like that you do. Okay. This other very powerful tool internationally, what has been approved and then found useful in n number of studies across the whole world is the SMS. Sanitizing your hands properly, how to wash your hands, watch videos. I'm not going to show. You must at least rub the soap completely on both the sides of the hand into the digits and onto the hand also, and then to the wrist, and then wait for 20 seconds. Not immediately wash. This 20 seconds means happy birthday to Micro Labs, happy birthday to, like that you sing for 2-3 times. Then it will be 20 seconds. Then you wash. Okay, that is the sanitization of the hand. Soap is a perfect antidote for coronavirus. It is 300 times more powerful than remdesivir. I'll tell you. Okay, use that. And second one is use a proper mask. I'm also not going to demonstrate the mask use. You see my other videos. And social distancing. India never practiced hugging, kissing, and then body contacts earlier. Of late only, last 50-60 years, we have this so-called intimate mixing of people. We don't require. We require to stay at least 2 to 3 meters from other persons while talking, while sitting. This is the practice. That is important. More so when you are meeting people who are not your householders, who are strangers. Okay? SMS. Remember, first thing I showed you about breathing. Second thing is SMS is the watchword. Sanitization of the hand and never cough into your hand. Don't do that. Don't blow the cough also to others. This is the usual way when we get cough. Horrible. Should not do that. Use a clean handkerchief or a tissue like that, and then discard the tissue or wash the this one as much as you. And if nothing is available, cough into your left elbow or right elbow for that matter, and then change the dress every day. Okay, and next, how to how to use the pulse oximeter? I showed you non-nail polish. Warm your hands before doing the pulse oximetry. Just warm up your hand and rest for 5 minutes, and rest your hand on the chest level, and then put the machine onto the middle finger or the index finger, either one of them. Not to this and not to this. Okay, this is too big, it won't go, and this is too small, it cannot record. So either of the two fingers you use, and read after the readings become steady after a month, record the result, identify the time and date correctly, and then do a 6-minute test. And if it is going below 94%, okay, this is an alarm sign. And 92 and below, they require oxygen. Okay, this is the way we use the, I will also post this poster to you. This is a Government of India poster I will give you. And this is about the prone ventilation. When you lay supine like this, what will happen? The lungs are compressed by the pressure of the diaphragm and the heart, and they don't expand. These are the not expanded parts. See, this is not only this part is expanding. But when you lay, this is when you are supine. But when you are prone here, the weight is shifted down and lung expansion is very good. So when you are in the supine position, 85, poor oxygenation. When you are in the prone, 95, good oxygen. May not be a jump of 10%. You know, for illustration, we have put like that. 3 to 4% jump will definitely come. It is time to turn over. Cultivate a habit. If you are sleeping like, like Tataka, don't sleep like that. That's not the way. Open the mouth and then like that, you shouldn't sleep. Always close the mouth while sleeping. Breathe only through the nose. And on the left side, on the right side, on the prone position, at least for 25% of the time. That way your lungs become better. COVID or no COVID, these are health practices. And this is how we prone people. So while proning, you must have 2 pillows below the chest, 1 below the ankle region, 1 of course on the chest, on the head, below the head, and the arms are rested on the side. Pregnant women, those immediately after eating food, no proning. Okay? Now, how to set up a small isolation room? If you are in an apartment complex, you can all set up an isolation room where somebody is positive, they are shifted there and you are happy, and by phone you can monitor them. Dolo or paracetamol, Limc, vitamin C and Ginkgo with zinc, ORS Tetra Pak, blood sugar meter, pulse oximeter, oxygen concentrator if possible, infrared thermometer, BP monitor, gloves, some PPE kits, hand sanitizer, liquid soap, always liquid soap to avoid contamination, 3-ply medical mask or N95 mask, and then tissue papers, disposable covered. You make them a list. This list you procure and keep. Your community can easily afford except the concentrator, which might cost you around 60-70,000 now, 5-liter capacity. Everything else can be easily assembled. And in case of emergency, that kit can be used by somebody who is positive. And have at least a couple of kits like that. And at least 2 persons can be isolated there. Breathing exercises are a must. Prone position, normally our lower back parts of the lungs are not well aerated, lower and the back parts, and by doing these exercises, you will improve your ventilation. We need to do regular breathing exercises for preventing COVID. These are all preventive as well as curative measures. Watch the video, already I showed you how to do the proning, and download those government apps. Now, what are the home care guidelines for mild case? Coming to the treatment part. Limc or any other vitamin C 500 milligrams twice a day for 15 days, thereafter once a day or one more 15 days. 1 into 15 after the first 2 weeks. Okay, because you'll jet once a day for 15 days, extended probably up to 30 days. Okay, Dolo, when the temperature is over 100, you use, not below that. The temperature is more than 100, you can use 1, 2, 3 or 4 tablets of Dolo 650. Don't use any other powerful ibuprofen or diclofenac or any other NSAIDs or powerful drugs to reduce fever and body pain. Dolo is the only accepted thing. And if you are having breathing difficulty, if you are having cough, if you are having sputum coming out, phlegm, then you have to use an inhaler, Loopinhaler, Rivolizer, Rotahaler, or the metered dose inhalers. The thing that has to go is Budecort or Budamate, 400 mcg, twice a day must be used, minimum. When not everyone has COVID, those who have difficulty in cough, bringing out sputum, and they have chest congestion, they feel breathless a bit, throat gargling is a must after the Budamate, because this Budamate contains powder of steroid which gets deposited in the throat and you have to wash it. Otherwise, you will end up in throat pain and fungal infection. Of course, if the sputum is not freely coming with steam inhalation, use mucolite or ambroxol or any other sort of mucolytic agent, not cough suppressants. You should not use Monterey LC. You should not use. I'm not saying about the brand name. Montelukast with levocetirizine. Montelukast is an anti-allergic drug. COVID is not an allergic disease. Why do you want to use Montelukast? Likewise, LC is levocetirizine. It drives the respiratory tree. Don't use levocetirizine or cetirizine. They are not indicated. What am I to take? Mucolytic and expectorant. Steam inhalation. No cough suppressant. This drill, that drill, Benadryl, carrot drill, all those drills and all. You don't suppress the cough. Let the cough come and bring out the sputum. And the sputum should be properly disposed. In addition, there is an indication in some patients to take tab ivermectin, 12 milligram capsule. It is available per day, one capsule for 3 to 5 days, depending on the symptoms. Not everybody needs ivermectin. Ivermectin has got a selective role. That doesn't have a very strong evidence to say, yes, all of you take, but it is helpful. So we are giving. And most important thing is host of antibiotics, azithromycin, doxycycline, ciprofloxacillin, cephalexin, IV antibiotic. Never use, even if your doctor says. Please tell him, sir, let us wait. Why? Because antibiotics produce a lot of super infections. One among them is mucormycosis. You can be a candidate for mucormycosis if you don't use antibiotics discriminately. But if the treating physician decides you have an indication for antibiotic and he strongly feels it will help you, then of course, in a trained hand, antibiotics are very good weapons. In an untrained hand, don't buy azithromycin, this, that, I've taken last time for fever, this also I will take now, all these things will not work. Okay, you should not use antibiotics without proper medical prescription and proper supervision. Likewise, steroids. Don't use steroids in the first 5 days. You have no business to do that. Okay, likewise, the antihistaminics and then anticoagulants also you should not use, and then the cough suppressants also you should not use. What is prescribed here only should be used. What are they? Vitamin C, any brand, 500 milligrams 2 times a day, Bakersfield's Jet once a day, or any brand of B complex with zinc, and then Dolo 500, 650, 3, 4 or 2 tablets depending on the fever. If it is more than 100, and use the inhalations if you have chest congestion. Ivermectin if the doctor recommends. No other approved treatment. What I am speaking is the Government of India or an Institute of Medical Science recommendation. Anything doing other than this is not science. Unless there is a reason by the treating physician to do that particular intervention. This is the general thing which all of you can do. Okay, antibiotic use, stop. And don't use anticoagulants without doctor's guidance. Don't use steroids in the first week unless the treating physician feels. Okay, so these are some of the golden rules. Now, how to monitor a mild case? What are the things? So I told you what are the general measures, how to improve your breathing exercise, what is the role of isolation and all that, masking, SMS, then I told you what drugs you take, what you should not take, then I am also telling you how to monitor. This is a SpO2 oximeter, and then the respiratory rate you have to measure, and then the temperature, breathlessness, altered sensory. Out of which you can easily measure SpO2 and then pulse rate also, sorry. The sixth one I have not listed, heart rate or pulse rate. Okay, pulse rate will come in that, SpO2 will come there, temperature you can record, breathlessness you know, altered sensorium I have explained. Then how frequently? Every 6 hours. Keep a paper and then put lines and then fill there. Date, time and reading. Then early recognition for high is very essential for higher care is crucial. So whether the patient requires a higher care, you have to recognize early. This is the way we can save many patients, and you should heed to the advice. If the doctor advises, you have to get admitted. Don't waste your time. You need time is life here. Okay. What are the alarm features? SpO2 less than 94, respiratory rate more than 24, temperature continuously 101 for 1 or 2 days without coming down, breathlessness on mild exertion, not able to walk, talk or read a paragraph. These are the alarm signs. I am repeating, SpO2 in this, if the reading is consistently less than 94 in room air and respiratory rate is more than 24. How do I count respiratory rate? Put the hand on the upper part of your belly or lower part of the chest. Each time I breathe, my hand moves up, and like that count the number of movements per 1 minute, and that is called the respiratory rate. It is difficult for you self counting. If your caregiver can count when you are lying on the bed, the respiratory rate will be correct. How do you do that? I told you. And what is the cutoff? 24. Normally we breathe 15, 16, 18. Usually 24 we will not touch. So 24 means already there is a need for more oxygen in your body. There is a syndrome called happy hypoxia. It's not a very happy situation. It is called happy hypoxia. That means the body, if you don't monitor, they will not have symptoms of breathlessness, but they will be desaturating. You can only detect by these. If you detect happy hypoxia, you can treat them very well, very quickly. So I think I should be ending very shortly. Already 1 hour, maybe another 10, 15 minutes we will go. Breathlessness on mild exertion is also to be taken care of. So these are my monitorings of a mild case. So mild case maintenance, supposing he has finished the first for 1 week and he is no problem, he has not gone into the moderate degree, then continue vitamin C, B complex, dose if necessary, plenty of fruits, fluids, fruits, vegetables, rest, breathing exercises, balloon, respirometry, room walking, prone position, monitoring, all have to continue in the second week. After 14 weeks, you can bring the person into house after proper sanitizing the room and also washing of the person. So forget not breathing exercises, balloon, respirator, room walking, prone position, 6-minute walk test, all are part of the continuing process of recovery. If you have chest congestion, use the inhaler which we have said earlier. Some people will have continuing cough into the second week. No need to worry. Simple cough is no indication to run for help. Start using Budamate and Mucolite, you will become better. Now, what is a moderate disease? A moderate disease, supposing you are not able to admit the moderate disease for want of the patient is refusing, or patient is too old, or there is no hospital bed available, and the patient is in moderate disease, consult your doctor. These, of course, will go. Your doctor will put on a sort of blood thinner for 5 days, 5 milligrams. Thereafter, he will reduce to 2.5. Don't take them on your own under the medical help. And then minimum 8 milligrams of Medrol. If necessary, doctor may give 16 into 3 also. 16 milligrams. And after that, he will bring it down to 8 milligrams, then to 4 milligrams, like that. A good steroid use is the only way to save a person from entering into severe disease. Having said that, steroids are not the treatment for mild disease, neither the blood thinner for the mild disease. Only when the patient is in moderate disease, we have to put them on Eliquis and Medrol. These are special drugs, not to be used like anyone. You don't give the knife to everybody. Only who is trained to use the knife will use it. Supposing the carpenter is there, we want to use his saw and then cut it. We will first cut our hand, not the wood. So likewise, the doctors who are trained to use them, they will use it, but you don't have to visit them, have a video consultation, and then tell them that you are in the moderate disease because of the monitoring. They'll advise you and give you a prescription for that, and as per their guidance, you take the blood thinner to 5 milligrams for 5 days to 7 days, then brought down to 2.5 milligrams for 7 more days. Likewise, Medrol 16 milligrams, you start off, they will start off and then bring it down. This is decided by the doctors based on one, your 4 monitorings which you had here, the monitorings you did, and in the monitoring any problem is there, or if the CT scan that is done shows some lung involvement, anything more than 8 by 25 score is considered as moderate disease in the CT. At that time they use. But here still the patient is not desaturating. That means the oxygen levels are being maintained, but other fever is continuing, or respiratory rate is more, or is becoming breathless, then treat with this. Of course, next pro, because you are giving the steroid to prevent the stomach irritation, we give that. Oxygen mask, if available, or oxygen concentrator, 2 to 6 liters per minute can be given under medical supervision. Remember, oxygen is a drug, cannot be just like that connected to the mouth or nose. In select cases, oral steroids and anticoagulants, that's what 4 and 5, not for everyone. And breathing exercises, these all things will continue. Now, moderate disease maintenance. Suppose he has recovered from the moderate disease, what will we do? Same vitamin C, B complex, Dolo if necessary, bring down the blood thinner, Eliquis from 5 milligrams to 2.5, Medrol from 8 to 4, and then completely bring it down. Monitoring has to be done. Okay, what if the patient is having low oxygen saturation? Then he needs to get admitted. Then this is hospital treatment. They will use powerful steroid in the hospital. They will use blood thinner in the injectable form, remdesivir only in selected cases, and they will use different types of oxygen methodology. Remember, oxygen is a drug and should not be just like that used. And these cylinders can be very dangerous, and they can produce a sort of blast in the house, like gas cylinders. So beware of those things. Monitoring the disease progression is important. Inflammatory markers will be done. HRCT will be done in the hospital. Diabetes control, I told you, will worsen for 3 reasons. One, because the COVID itself increases the diabetogenicity from the pancreas, insulin doesn't come. Second thing is because you are using the sort of very powerful steroids to control the disease. And thirdly, because you are taking sort of overnutrition to get out of the disease altogether, and then activity is reduced, so sugar consumption is lower. So naturally, there will be a negative sugar balance. That means higher sugars and have to be treated if necessary by oral drugs or insulin depending on the sugar levels. Diabetic control is essential. Supportive measures, and remember, no convalescent plasma. Government of India has removed the plasma donation from recovered cases was being practiced. That is removed. Even this remdesivir is going to be out of use recommendation for general use in hospital patients unless in specific situations. The one indication is patient must be having low oxygen saturation. Number 2, he must be between 5 and 14th day, 12th day of illness. Number 3, he must have patient should have good renal and hepatic function and non-pregnant. Good renal, hepatic function, non-pregnant, oxygen saturation going down in spite of the steroids, and he is in the middle week of the disease, not in the first week, not in the third week, then we can use remdesivir as per the current guidelines. Don't worry about whether remdesivir, it is not the end all or cure all of COVID, and if remdesivir is not given, heavens are not going to fall. But more important, powerful steroid, blood thinners, monitoring, oxygen will be helpful in that case. So what are the blood tests? I've given you a comprehensive list here. Complete blood count, LDH, CRP, D-dimer, fibrinogen, LFT, renal function, based on your doctor's recommendation, and HRCT also at the end of 5th or 7th day, and if the symptoms persist. Then serum ferritin, procalcitonin, rope I, interleukin, blood sugar, HbA1c, these are all prescriptions. You should not go and do all these tests. So you have to consult a doctor. At least you consult me, if possible. We'll order you the test. And there is this is a comprehensive panel. There's another panel called concise panel, wherein some tests are reduced if somebody cannot afford, or if it is already the first baseline, we have all the 12, the follow-up can be based on these 8. Okay. Now, how do I win the battle? How do I spend the time? Indoor play, relaxation exercises, yoga and meditation, aerobic exercises, prayer. Prayer, whatever may be your faith, no problem. Every God answers in the same way. Pray well, because prayer has got 2 direct benefits. One, it will give you a beautiful peace of mind and tranquility. Second thing is, in prayer, you don't pray for yourself. You pray for everybody else. That is the most important thing. No prayer you think will be unanswered. There are gods and demigods waiting to answer the prayer. Prayer is the best sort of non-human help you can think of in such a bad situation. Do some creative activities. Always don't watch negative news, negative thinking. Have positive thinking. Installation of hope in others who are affected. Good material, you would have thought, I wanted to read this book, that book, good books. Take them out. Rabindranath Tagore, Vivekananda, or whatever you think, And then listen to soft music, and online learning courses are there. You learn. This is a way of coping up with the pandemic and home isolation. If home is the safest place, can be productive from home also. We are all productive. For the last 1.5 years, I did not move out of my main door. But still, we were very productive. Equality of all before COVID. No race, no gender, no faith, no religion, no caste, no creed, no language. We have seen the equality of all of us before God, and we are seeing before COVID. We can live without our luxuries. 1.5 years we lived, and save that money for useful things. Avoid wasteful travel, and consider any travel unless it is emergency. You put it off. And any function like the ear boring or head shaving or some group pravesa, this, Upanayana, that, all you postpone for a while. And COVID taught us how civilized we should behave. We have now a less air pollution and less disease. Of other diseases have now become very less. So what are the golden rules? Whatever vaccine is available, take without hesitation. Don't compare, this is 80%, that is 82%. Take. Vaccines have prevented deaths. We have seen in the last 1.5 months, everybody was vaccinated. Either they did not get the disease, or the disease was mild and did not go into moderate and severe. SMS, don't forget, this is the best and most approved intervention to prevent and then control COVID transmission. High index of suspicion, early isolation, testing are the golden rules. Careful monitoring of a probable and confirmed case from day 1. Do not be afraid to use steroids as prescribed when you need. Oh, it is steroid, I don't want to take. No. When there is fire, you have to put out the fire first. And later on, of course, the damage by the steroids will be monitored and taken care of. Monitor sugars, keep good blood sugar control. Beware of post-COVID manifestations. A disease called black fungus can emerge in people who are treated for cold, who are diabetics, who have immunocompromised state and who are in ICUs and who had powerful steroids used for controlling the disease, they can turn up as candidates for black fungus. This seminar today is not on black fungus, so I'm not touching very much on that. Spread awareness to everyone whom you know. This is the action plan, not fear. Don't share fatal news at all. Now, if you don't catch me, I don't catch you. This is what the COVID tells. You run after the COVID patient or COVID zone into malls, theaters, hospitals unnecessarily, and onto the road, into the trains, crowded places, and bus stands, and travel in the air, you catch it. Test, trace, and treat is the mantra of our Prime Minister. Empower the public is the strategy. No visitor, no visiting is the mantra for avoiding corona visiting us. Recovery is the rule. Serious disease is an exception. Panic and fear are not at all prudent. Avoid negative behavior, avoid chat news and forwards, unnecessary forwards and rumors. Preparedness and acting right is a civilized responsibility. Stay home, stay safe, stay healthy, and be a socially responsible person. Believe me, believe in the Almighty. Even this will change. Things are going to be definitely better. It's not going to be like that. Prayer and faith on Almighty is very important. But unless you take care of all the things that are told till now, simple going to a photo and praying, oh God, save my father. No. Or save me, he will not save. If you have not done your job, God is going to refuse your prayer. Take it from me. God will not answer such prayers. God is answering and helping only to those people who put their best foot forward and do all that is possible in their hand to control disease in them and prevent transmission to others. With this, I'm going to end. I think we just took around 1 hour 5 minutes or 1 hour 8 minutes. That is good enough. Now my friend Prasad and other colleagues will moderate the questions and we will do that.
Yes, sir.
Namaste, this is the best way.
Yeah, thank you, sir.
Okay.
Excellent presentation. Lot of information you have given.